Hey guys, tonight we're going back, way back, like 3,000 years before anyone figured out germs were a thing back. We're talking ancient Egypt, land of pyramids, cats, and surprisingly decent healthcare. So get comfortable, dim those lights, maybe grab a warm drink, because we're about to spend the next couple hours exploring how people actually became doctors in ancient Egypt. And trust me, it's weirder than you think, but also kind of impressive, and definitely the kind of rambling historical deep dive that'll have you drifting off in no time. Now, when most people think about ancient Egypt, they think about mummies, right? The whole wrapping dead people in linen thing. Maybe some curses, definitely some gold masks. But here's the thing that's actually wild. The Egyptians were so obsessed with preserving bodies after death that they accidentally became some of the best doctors in the ancient world while they were still alive. It's like they reverse-engineered medicine from corpses, which, is one way to do it. So let's start with the basics. If you were living in ancient Egypt and you wanted to become a doctor, you weren't just grabbing a scalpel and calling yourself a physician. There was actually a whole system, a surprisingly organized, surprisingly sophisticated system that would put a lot of medieval European medicine to shame. But we'll get to the medieval Europeans and their absolutely unhinged medical practices another time. Tonight, we're focused on the Nile. First thing you need to know, in ancient Egypt, doctors were called SW&W. That's the ancient Egyptian word, and it literally translates to something like the man of those who are injured or just healer, depending on which Egyptologist you ask. And yes, most doctors were men because of course they were. This is ancient history we're talking about. Though interestingly, there were some female physicians too, which we'll get into later because one of them was absolutely legendary and we need to talk about her. But anyway, if you wanted to become a SW&W, you generally had a few paths available to you, and they all depended pretty heavily on who your daddy was. Shocking, I know. Social mobility in ancient Egypt? Not exactly a thing. If your father was a doctor, congratulations, you were probably going to be a doctor too. The profession ran in families. Medical knowledge was passed down from father to son like a really morbid family recipe book. Except instead of grandma's cookies, it's here's how to drill a hole in someone's skull without killing them immediately. These medical families were part of what we call the educated elite. You had to be literate, which already put you in a pretty exclusive club. Most ancient Egyptians couldn't read or write. They were too busy farming or building pyramids or doing literally anything else to survive. But doctors needed to read medical texts. They needed to write down their observations. They needed to keep records. So if you were born into a family that had access to education, that was step one. Now, let's talk about the training itself because this is where it gets interesting. Young aspiring doctors would typically start their education at something called the Per-Ankh, which translates to House of Life. Great name, right? Very reassuring. The House of Life wasn't just a medical school though. It was more like a combination of a library, a scribal school, a temple, and a research center all rolled into one. These institutions were attached to major temples throughout Egypt, and they were basically the ancient world's version of universities. At the House of Life, student doctors would learn to read and write hieroglyphs and hieratic script. Hieratic was the cursive version of hieroglyphs, basically used for everyday documents. Much faster to write than drawing tiny birds and ankhs all day. And they needed to master this because all of the medical texts were written in hieratic. These texts were incredibly important. They were basically textbooks, but they were also considered sacred knowledge, protected by the gods. The most famous of these medical texts is the Edwin Smith papyrus, which we'll definitely be diving into later because it's genuinely remarkable. But there were others too. The Ebers papyrus, the Cahen papyrus, the Berlin papyrus, the London medical papyrus. Honestly, these things turn up in museum collections all over the world now. But back in ancient Egypt, they were treasured documents kept in these houses of life, and student doctors would spend years studying them, copying them, memorizing them. And what was in these texts? Well, everything from surgical procedures to prescriptions to magical spells. Because here's the thing about ancient Egyptian medicine. It was this fascinating mix of practical, empirical observation, and religious ritual. The Egyptians believed that disease could be caused by natural factors, sure, but also by angry gods, by demons, by curses, by bad air, by an imbalance in the body. So treatment often involved both physical medicine and spiritual protection. A student doctor had to learn both sides of this. They had to know which herbs treated which symptoms. They had to know how to set broken bones, how to stitch wounds, how to diagnose different diseases based on symptoms. But they also had to know the right prayers to recite, the right amulets to prescribe, the right offerings to recommend to various gods. You weren't just treating a body. You were treating a whole person in a world absolutely filled with supernatural forces that could mess you up at any moment. So the training was long. We're talking years, maybe even decades for the most advanced physicians. There was no quick certification program, no online course you could knock out in 6 months. You started young, probably around age 7 or 8 if you were lucky enough to be in the right family, and you studied for years under experienced doctors. It was very much an apprenticeship model. You'd shadow your teacher, watch them work, help them prepare medicines, hold tools during procedures, and gradually, over time, you'd be allowed to try things yourself under supervision. And the studying wasn't just book learning either. The Egyptians were big on hands-on experience. Remember how I mentioned they were really into mummification? Well, that meant that Egyptian doctors had something that most ancient physicians didn't have: actual knowledge of what the inside of a human body looked like. They weren't just guessing about anatomy. They'd seen it, they'd touched it, they'd removed organs and preserved them in canopic jars. They knew where the heart was, where the liver was, where the stomach was, how the intestines coiled around inside you. Now, did they understand how all of these organs worked? Not exactly. They had some interesting theories, though. The Egyptians believed that the heart was the center of intelligence and emotion, which honestly makes more sense than you'd think because your heart rate does change with your emotions. They thought the brain was basically useless, just some weird packing material in your skull. During mummification, they'd pull it out through the nose with a hook and throw it away. The heart? That got left in the body because you'd need it in the afterlife. Priorities, you know? But even with some misconceptions, the anatomical knowledge Egyptian doctors had was genuinely impressive. They understood that the body had a system of channels called metu that carried blood, air, water, and other fluids throughout the body. They didn't quite get the circulatory system right, but they were observing and theorizing, which is more than a lot of ancient cultures were doing. They knew that the pulse was connected to the heart. They could count pulse rates. They understood that if certain metu were blocked or damaged, it could cause problems in other parts of the body. This brings us to one of the really important aspects of Egyptian medical training: examination and diagnosis. Student doctors learned a very systematic approach to treating patients. First, you examined them thoroughly. You looked at their skin, their eyes, their tongue. You felt for fever. You smelled their breath, their sweat, their wounds. You asked them about their symptoms. When did the pain start? Where exactly does it hurt? Is it a sharp pain or a dull ache? Have you been eating normally? How's your digestion been? The Edwin Smith papyrus, which again we're going to get into in detail, literally provides a template for this examination process. Each case study in that text follows the same format: title of the injury, examination procedures, diagnosis, and then verdict. The verdict was basically the prognosis, and it fell into 3 categories: an ailment which I will treat, an ailment with which I will contend, or an ailment not to be treated. In other words, yeah, I can fix this, maybe I can fix this if we're lucky, or nope, you're screwed, good luck with that afterlife. And this is something else student doctors had to learn: when to be realistic about outcomes. Ancient Egyptian physicians seem to have had a pretty good grasp on what was treatable and what wasn't. If someone came in with a serious head injury, compound skull fracture, brain exposed, they weren't going to pretend they could save them. They'd make the patient comfortable, maybe prescribe some pain relief, but they knew their limits. Which is more than you can say for a lot of doctors throughout history who just kept trying increasingly unhinged treatments even when the patient was obviously doomed. Now let's talk about the actual medical treatments these students were learning to administer, because some of them were genuinely effective and some of them were absolutely wild. On the effective side, the Egyptians had a pretty solid understanding of wound care. They knew to clean wounds thoroughly. They used lint, grease, and honey as bandaging materials. And here's the thing: honey is actually antimicrobial, prevents infection. The Egyptians didn't know about bacteria, obviously, but they knew empirically that wounds treated with honey healed better than wounds that weren't. That's evidence-based medicine right there. Accidental, maybe, but still effective. They also used moldy bread on wounds sometimes, which sounds disgusting, but guess what? Penicillin comes from mold. So again, they stumbled into something that actually worked without understanding the mechanism. They just knew moldy bread on wound gets better. Alright, let's keep doing that. For broken bones, Egyptian doctors were actually quite skilled. They could set fractures, and they created splints using wood and linen bandages. The Edwin Smith papyrus describes treating broken collarbones, broken noses, dislocated jaws. There are even mummies that have been found with well-healed fractures, which tells us that the treatment they received worked. The bones set properly. The patient survived and went on to live for years afterwards. Surgery was definitely part of Egyptian medical practice, though it was probably the specialty area that required the most advanced training. The most common surgical procedure was probably treating abscesses and tumors. If you had a growth somewhere, a trained surgeon could cut it out. They had bronze and copper surgical tools. Knives, scissors, forceps, hooks, saws. They understood the importance of sharp instruments. A clean cut heals better than a ragged tear. One surgical procedure that the Egyptians definitely performed, and this is going to sound intense, was trepanation. That's drilling a hole in someone's skull. We found Egyptian skulls with these neat circular holes drilled into them, and the bone shows signs of healing, which means the patient survived the procedure. Why would you drill a hole in someone's head? Various reasons. Maybe to relieve pressure after a head injury. Maybe to treat severe headaches or epilepsy. Maybe for ritual purposes. It's hard to say, but the fact that they could do it and have the patient survive tells you something about their surgical skill. Did they have anesthesia? Probably not in the way we think of it. But they did have opium, which grew in Egypt and the Eastern Mediterranean. They had alcohol. They had various sedative herbs. So they weren't just holding people down and cutting into them while they screamed. They had ways of managing pain, even if those ways weren't perfect. Student doctors also had to learn pharmacy, which was a huge part of ancient Egyptian medicine. The Ebers Papyrus, which is probably the most comprehensive medical text we have from ancient Egypt, contains over 800 prescriptions. 800! That's an enormous pharmacological knowledge base. These weren't just random plants thrown together either. The prescriptions are specific. They list exact ingredients, exact quantities, and exact preparation methods. Some of these ingredients were pretty standard herbal remedies that we still use today. Aloe for skin problems, castor oil as a laxative, garlic as an antibiotic, fenugreek for digestive issues, coriander for various ailments. The Egyptians had access to a lot of medicinal plants both locally and through trade, and they experimented extensively to figure out what worked. But then some of the ingredients were less scientifically sound. Lizard blood, crocodile dung, the crushed skull of a catfish, the fat from various animals, ground up stones and minerals, the urine of a faithful wife. Yes, that's a real ingredient in some prescriptions. How exactly they verified the faithfulness of the wife is left as an exercise for the reader. So where were we? Right, the faithful wife's urine. Look, ancient medicine is weird everywhere, but Egyptian medicine had this very particular brand of weirdness where they'd combine genuinely effective treatments with stuff that was clearly just someone's wild guess. And student doctors had to memorize all of it. They had to know that for a cough, you might prescribe honey and milk, which actually soothes the throat, but also maybe throw in some frankincense and myrrh because those are sacred and expensive, so they must work, right? And perhaps a bit of crushed beetle for good measure. Because why not? The preparation methods were elaborate too. Some medicines had to be ground into powder. Others had to be boiled into decoctions. Some had to be mixed with beer or wine. Others with milk or water or oil. Some were taken internally, some applied externally. There were ointments, poultices, suppositories, eye drops, ear drops, inhalations. The Egyptians had figured out multiple delivery systems for getting medicine into or onto the human body. And the dosing instructions could be surprisingly specific. Take this remedy 3 times a day for 4 days. Apply this ointment every morning for a week. Drink this mixture before bed. The Ebers papyrus even includes some prescriptions with warnings like, do not repeat too often or use sparingly, suggesting they understood that some medicines could be dangerous in high doses, which is more pharmacological sophistication than you might expect from the Bronze Age. Now, one thing that's really interesting about Egyptian medical training is that doctors could specialize. This wasn't a system where every doctor did everything. By the time of the New Kingdom, and probably earlier, Egyptian medicine had developed into distinct specialties. You could be a general practitioner, sure, but you could also focus on specific areas of the body or specific types of ailments. Herodotus, the Greek historian who visited Egypt in the 5th century BCE, wrote about this. He said that Egypt was full of physicians and that each physician treats one disease and no more. He mentioned specialists for the eyes, for the head, for the teeth, for the belly, and for obscure diseases, which probably meant internal problems that weren't immediately obvious from external examination. So if you were training to become a doctor in ancient Egypt, at some point you had to decide what kind of doctor you wanted to be. Did you want to be a general SWNW, treating everyday ailments in your community? Or did you want to pursue advanced training in a specialty? Let's talk about some of these specialties, because they're fascinating. Eye doctors were particularly important in ancient Egypt. Eye diseases were extremely common because of the bright sun, the desert sand and dust constantly blowing around, and various parasites and infections that affected the eyes. Trachoma, conjunctivitis, cataracts, these were widespread problems. So there was a real need for specialists who knew how to treat eye conditions. The medical papyri contain numerous remedies for eye problems. Solutions made from copper salts, which actually do have antimicrobial properties. Mixtures of honey and various herbs. Some prescriptions that were probably useless, but at least wouldn't make things worse. And eye doctors had specialized tools too. Bronze instruments for removing foreign objects from the eye, for applying medications, possibly even for performing early cataract surgery, though the evidence for that is debatable. Then you had dental specialists. Dentistry was another major concern in ancient Egypt, and this might surprise you given that they didn't have refined sugar. But Egyptian bread was full of grit and sand from the grinding stones used to mill the grain. Over time, all that sand wore down people's teeth to nubs and caused serious dental problems. We've examined Egyptian mummies with abscessed teeth, cavities, severe wear, periodontal disease. Their teeth were a mess. Dental specialists could extract teeth, though that was probably a last resort because it was painful and dangerous. They treated abscesses with drainage and poultices. They prescribed remedies for toothache and gum inflammation. There's evidence that they might have used rudimentary fillings made from a mixture of resins and ground minerals, though this is still debated by scholars. What we know for sure is that dental pain was recognized as a serious medical problem, and there were specialists trained to deal with it. Stomach doctors, or gastroenterologists if we want to use the fancy modern term, were another important specialty. Digestive problems were incredibly common in ancient Egypt. Parasitic infections from the Nile water, dysentery, constipation from a grain-heavy diet, liver disease. The Egyptians were very concerned with digestive health, to the point that they had a somewhat obsessive focus on purging and purgatives. The Ebers papyrus contains dozens of remedies specifically for constipation. Laxatives made from castor oil, figs, dates, colocynth, senna. They really wanted to keep things moving through the digestive tract. The historian Herodotus noted that Egyptians purged themselves regularly, 3 days out of every month, because they believed that most diseases originated from food, which isn't entirely wrong, given the parasite situation, but they may have taken the purging thing a bit far. Student doctors training in gastroenterology would have learned to diagnose different types of abdominal pain, to distinguish between problems of the stomach versus the intestines versus the liver. They learned which remedies to prescribe for diarrhea versus constipation. They learned about dietary recommendations. And they probably learned to keep a straight face when prescribing some of the weirder remedies, like the one that calls for a mixture of fresh dates, crushed in a pellet of dung, and taken internally. Yes, internal dung pellets. That was apparently a thing. There were also specialists in what we might call obstetrics and gynecology, though this is where things get a bit complicated because much of the medical care for women, especially around childbirth, was probably handled by midwives rather than physicians. Midwifery was traditionally women's work, but there are medical texts that deal specifically with women's health, pregnancy, childbirth, and fertility. The Kahan papyrus, for example, is almost entirely focused on gynecological issues. It describes various uterine and vaginal problems, provides diagnostic techniques, and offers treatments. Some of these treatments are, well, they're creative. There's one remedy for a prolapsed uterus that involves placing the woman over a fire fueled with incense and letting the smoke waft upward. The theory was apparently that the uterus would retreat back into the body to escape the smoke. Did this work? Probably not in the way they intended, but hey, it's the thought that counts. Fertility was a major concern, obviously, as it has been throughout most of human history. The Egyptians had various tests for fertility and for determining pregnancy. The most famous one involved urinating on wheat and barley seeds. If the wheat sprouted, you were pregnant with a girl. If the barley sprouted, you were pregnant with a boy. If neither sprouted, you weren't pregnant. And here's the wild thing. Modern research has actually shown that pregnant women's urine does contain hormones that can promote seed germination. So this test was actually detecting something real, even if the boy or girl part was nonsense. Ancient Egyptian pregnancy test. Genuinely worked. How about that? Childbirth itself was handled by midwives, as I mentioned, but physicians might be called in if there were complications. The medical texts describe breech births, difficult labors, postpartum hemorrhaging. They knew these were dangerous situations. They had some interventions they could try, though realistically, without modern surgical techniques, there wasn't much they could do for the worst complications. Maternal and infant mortality rates were high, as they were everywhere in the ancient world. Now, beyond these physical specialties, there was another category of medical professional that we need to talk about: the priest-physicians. Because remember, Egyptian medicine wasn't purely secular. It was deeply entwined with religion. Many doctors were also priests, serving in temples and performing religious duties alongside their medical practice. The goddess Sekhmet was particularly associated with disease and healing. She was a lion-headed goddess, fierce and dangerous, who could send plagues but could also cure them. Priests of Sekhmet were often doctors, specializing in treating epidemics and pestilence. They performed rituals to appease the goddess while also administering practical medical treatments. It was a both-and situation, not either-or. Then there was Thoth, the ibis-headed god of writing and knowledge, who was also associated with medicine and magic, and Isis, who was revered as a great magician and healer. Medical knowledge was seen as a gift from the gods, and many of the medical texts frame their contents as divine wisdom passed down from the deities to humanity. So if you were training as a priest-physician, your education included not just medical texts, but also religious texts, ritual procedures, magical spells, and divine hymns. You learned to call upon the gods for assistance in healing. You learned to create magical amulets and protective spells. You learned the proper offerings to make at temples for different ailments. And this magical component wasn't just window dressing. The Egyptians genuinely believed that words had power. Speaking the right spell, inscribing the right incantation, wearing the right amulet, these things could protect you from disease or help you recover from it. Many medical papyri include both pharmaceutical prescriptions and magical spells side by side, to be used in conjunction with each other. For example, there's a spell in the Ebers papyrus to be recited when administering a remedy for headache. The spell invokes the story of how Horus got a headache when he was a child and how Isis cured him. By reciting this spell over the patient and over the remedy, you're essentially asking the gods to repeat that mythological healing in the present moment. It's sympathetic magic combined with herbal medicine. Student doctors had to memorize these spells along with everything else. They had to learn to recite them correctly, with the proper intonation and gestures. Because a spell said wrong might not work, or worse, might have unintended consequences. Magic was serious business. You couldn't just wing it. There were also specialized magician doctors called Sao, who focused more on the magical side of healing than the physical. These practitioners dealt with curses, demonic possession, supernatural ailments that couldn't be treated with ordinary medicine. If someone believed they'd been cursed by an enemy, or if they were suffering from nightmares and night terrors, Or if they had some mysterious ailment that didn't respond to normal treatment, you'd go see a sow. The sow would perform elaborate rituals to identify the supernatural cause of the problem. They'd consult oracles, interpret dreams, perform divination. Then they'd prescribe magical remedies, amulets to wear, spells to recite, offerings to make, purification rituals to undergo. Sometimes they'd create magical wands or figurines to protect the patient. Sometimes they'd write spells on papyrus that the patient would wear around their neck or dissolve in water and drink. Now, was this effective medicine? From a modern scientific perspective, obviously not. But from a psychological perspective, if you believed you were cursed and then a specialist performed a ritual to remove the curse, you might very well feel better afterwards. The placebo effect is real and powerful. And in a world where people genuinely believed in supernatural forces, addressing those beliefs was arguably a legitimate form of medical care. So if you were a medical student in ancient Egypt, you had choices. You could go the route of practical, physical medicine, specializing in surgery or pharmacy or a particular part of the body. You could go the priest-physician route, combining medicine with religious service. You could go the magical route, becoming a sow. Or you could try to master all of it, becoming a comprehensive healer who could address any type of ailment, physical or supernatural, with whatever treatment seemed most appropriate. And the training for all of this took years. We don't have exact numbers, but based on what we know about apprenticeship systems in other ancient cultures and the sheer volume of knowledge Egyptian doctors needed to master, we're probably talking about 10 to 20 years of training to become a fully qualified physician. You'd start as a child, studying basic literacy and numeracy. Then you'd move on to reading medical texts. Then you'd begin practical training under a mentor. Then eventually, if you were skilled and lucky, you'd be recognized as a doctor in your own right. Recognition was important because there was apparently some form of official certification or licensing. We know this because there were titles, not just SWNW for doctor, but more specific titles indicating rank and specialization. Chief Physician, Inspector of Physicians, Royal Physician. These weren't just self-proclaimed titles. They were official positions in the bureaucracy, and they came with responsibilities and privileges. Royal physicians, in particular, were elite members of society. They served the pharaoh and his family, which was obviously a prestigious position but also a dangerous one. If the pharaoh got sick and died despite your treatment, that could go very badly for you. On the other hand, if you successfully treated the pharaoh or saved the life of a prince or princess, you could be richly rewarded with land, gold, and honors. We know the names of some royal physicians from inscriptions and tomb reliefs. Imhotep, who served Pharaoh Djoser in the 27th century BCE, was so renowned that he was later deified as a god of medicine. Hizire, who lived around the same time, was chief of dentists and physicians, which must have been quite the business card. Kar, who served in the Old Kingdom, was royal physician and overseer of physicians. These men were important enough that they had elaborate tombs built, with detailed inscriptions describing their accomplishments and titles. And then there's Peshet, who lived during the Old Kingdom and who might be the earliest female physician on record. Her title was Lady Overseer of the Female Physicians, which suggests there was a whole group of female doctors under her supervision. We don't know much about her beyond this title, unfortunately, but the fact that she existed and held an administrative position tells us that women could enter the medical profession in ancient Egypt, even if they were probably a minority. Female doctors likely specialized in treating female patients, especially for issues related to pregnancy, childbirth, and gynecological problems. It makes sense that women might prefer to be examined and treated by other women for these intimate concerns. But we have so few records of individual female physicians that it's hard to say exactly how common they were or what their training looked like compared to male physicians. What we do know is that medical knowledge was valuable and closely guarded. Those medical papyri we keep talking about, they weren't widely available. They were kept in the houses of life, in temple libraries, in the collections of wealthy physicians who could afford to commission copies. A medical text was expensive. Papyrus wasn't cheap, and having a scribe copy out an entire medical treatise would cost a significant amount of money. So access to these texts was a form of privilege. If you were born into a medical family, you had access to your father's or your grandfather's copies of medical texts. You could study them at home. If you weren't born into that kind of family, you needed to gain entry to a house of life, which required connections and probably payment of some kind. Medical knowledge was intellectual property, and it was protected. This actually led to an interesting dynamic where some medical knowledge was public and some was secret. Basic folk remedies, the kind of stuff everyone knew, drink this tea for a cough, put honey on a burn, that was common knowledge. But advanced techniques, complex prescriptions, surgical procedures, the really valuable medical information, that was specialized knowledge passed down through professional networks. Medical hierarchies, mummies, and mistakes. So you've got this system where medical knowledge is concentrated in the hands of a professional elite, guarded in temple libraries, passed down through families and formal apprenticeships. And this creates a hierarchy naturally. At the top, you've got the royal physicians, the chief physicians, the inspectors of physicians. These are the guys with decades of experience, extensive libraries of medical texts, prestigious positions in the pharaoh's court. They're treating the most important patients in Egypt, dealing with the most complex cases, and they're getting paid handsomely for it. Below them, you've got regular physicians with established practices. They might serve a particular temple or work in a specific city or be attached to a noble household. They're competent, experienced, successful enough to make a living as full-time doctors. They're the solid middle-class professionals of the Egyptian medical world. And then you've got the students, the apprentices, the young doctors just starting out. They're still learning, still building their reputations, still making mistakes and hopefully learning from them. Some of them will rise through the ranks to become respected physicians. Others will remain local healers treating minor ailments in small villages. Some will probably wash out of the profession entirely and end up doing something else with their lives. But here's what's interesting. Even with this hierarchy, Egyptian medicine seems to have had some accountability built into it. Those medical texts we keep referencing, they don't just describe successful treatments. They also describe failures. They acknowledge when treatments don't work. The Edwin Smith papyrus, in particular, is remarkably honest about medical limitations. Remember those 3 verdict categories I mentioned earlier? An ailment which I will treat, an ailment with which I will contend, and an ailment not to be treated? That third category is basically saying, this patient is going to die and there's nothing I can do about it. And the fact that this is written down in a medical text taught to students accepted as a legitimate medical conclusion, that's significant. It suggests that Egyptian physicians weren't expected to pretend they could cure everything. They were expected to make accurate diagnoses and honest prognoses. There are case studies in the Edwin Smith papyrus where the physician examines a patient, determines that the injury is fatal, and recommends no treatment beyond comfort care. That's remarkably pragmatic. And it probably protected doctors from being blamed when patients died from untreatable conditions. If the medical literature itself says this type of injury cannot be treated, then the doctor can't really be held responsible when the patient dies. That said, we don't actually know what happened to Egyptian doctors who were accused of malpractice or whose patients died unexpectedly. Were there legal consequences? Could you sue a doctor for negligent treatment? The historical record is mostly silent on this question. We have legal texts from ancient Egypt, but they don't mention medical malpractice specifically, which might mean it wasn't a major concern, or might mean that such cases were handled informally within the medical profession, or might mean we just don't have the relevant documents. What we do know is that Egyptian medicine, for all its sophistication, still had some absolutely wild misconceptions built into it. The biggest one, which I touched on earlier, was their understanding of what the heart actually did versus what the brain did. They knew the heart was important. They could feel the pulse. They observed that if the heart stopped beating, the person died. So they concluded that the heart was the seat of consciousness, intelligence, emotion, and personality. The brain? Useless meat. The Egyptians thought the brain was basically packing material, some kind of cranial cushioning. During mummification, the brain was removed through the nasal cavity using a long hook. The embalmer would break through the ethmoid bone at the top of the nasal cavity, insert the hook, scramble up the brain tissue, and then tip the body forward so the liquefied brain matter would pour out through the nose. Delightful process. Then they'd pack the skull cavity with linen or resin to maintain the head's shape. The brain itself was discarded, just thrown away. Not needed for the afterlife, apparently. The heart, meanwhile, was carefully preserved inside the body. It was the only internal organ that wasn't removed during mummification. Why? Because when you died and went to the afterlife, your heart would be weighed against the feather of Ma'at, the goddess of truth and justice. If your heart was heavy with sin, you'd fail the test and be devoured by Ammit, the demon who ate the souls of the unworthy. If your heart was light and pure, you'd be granted eternal life in the field of reeds. You absolutely needed your heart for this judgment process. The brain, not part of the equation. So you had these doctors who were genuinely skilled at anatomy, who had seen the inside of human bodies more than most ancient physicians ever would, who had sophisticated surgical techniques and effective treatments for many conditions, but who also thought that consciousness happened in your chest and your brain was irrelevant. It's a fascinating mix of empirical observation and complete misunderstanding. And this kind of thing happened a lot in Egyptian medicine. They'd observe something accurately, then come up with a totally wrong explanation for why it happened. They noticed that the body had channels that carried fluids: blood, air, water, mucus, urine, feces. This was accurate observation. They could trace blood vessels. They could feel the pulse in different arteries. They understood there was a system of distribution happening inside the body. But then they concluded that all of these channels, the metu, were basically interchangeable. They thought air from the lungs could travel through the same vessels that carried blood. They thought that fluids could move freely between different systems. They believed that if the channels in the anus got blocked, that could cause problems in other parts of the body, which is why they were so obsessed with laxatives and purging. Keep those channels clear and flowing and you'd stay healthy. Let them get blocked and disease would result. This is where the theory of the four humors that dominated Greek and Roman medicine actually has some similarity to Egyptian ideas, though the Egyptians never codified it quite as systematically as the Greeks did later. But there was this general sense that health was about balance and flow, and disease was about blockage and imbalance. Student doctors learned all of this. They learned the metu system. They learned about the channels and how to keep them flowing. They learned which treatments would clear blockages in different parts of the body. And from their perspective, this made perfect sense. It was a comprehensive theory of physiology and disease that explained their observations and guided their treatments. The fact that it was fundamentally wrong about some really basic stuff didn't matter because it was internally consistent and it led to treatments that often worked, or at least didn't make things worse. Now let's talk about one of the most important medical texts in detail, because it really shows you what Egyptian medical training was based on. The Edwin Smith Papyrus, which I keep mentioning, is genuinely one of the most impressive medical documents from the ancient world. It's named after Edwin Smith, the American dealer in antiquities who bought it in Luxor in 1862. But the papyrus itself dates back to around 1600 BCE, and it's probably a copy of an even older text, possibly written during the Old Kingdom, maybe around 2500 BCE. What makes the Edwin Smith Papyrus so remarkable is that it's almost entirely surgical and trauma-based. It's not prescribing magical remedies for every little ailment. It's a systematic treatise on treating injuries, presented as a series of case studies that proceed from the top of the head down through the body. Head injuries, facial injuries, neck injuries, shoulder injuries, chest injuries, and so on. It's organized, methodical, and surprisingly modern in its approach. Each case follows that standard format I mentioned: title, examination, diagnosis, verdict, and treatment if applicable. Let's walk through an example so you can see how this worked. Case 5 in the Edwin Smith Papyrus is titled Instructions Concerning a Gaping Wound in His Head, Penetrating to the Bone, Smashing His Skull, and Rending Open the Brain of His Skull. Already we're off to a rough start. This is clearly a serious head injury. The examination section describes what the physician should look for. If thou examinest a man having a gaping wound in his head, penetrating to the bone, smashing his skull, and rending open the brain of his skull, thou shouldst palpate his wound. Shouldst thou find that smash which is in his skull like those corrugations which form in molten copper, and something therein throbbing and fluttering under thy fingers, like the weak place of an infant's crown before it becomes whole. That description of the pulsating brain tissue. That's observation. Detailed, accurate observation. The comparison to molten copper is describing the corrugated appearance of the brain's surface. The comparison to an infant's soft spot is describing how the brain pulsates with the heartbeat, visible when the skull is broken open. This is someone who has seen this injury, who has touched an exposed brain, who knows what it looks and feels like. The diagnosis follows. Thou shouldst distinguish him from one whom something entering from outside has smitten, but he bleeds from both his nostrils and from both his ears, and he suffers with stiffness in his neck. So the physician is being instructed to note the bleeding from the nose and ears, and the neck stiffness, all of which are symptoms of serious brain trauma. And then the verdict: an ailment not to be treated. This patient is going to die. The text is completely upfront about it. There's no pretending that some magical spell or herbal remedy will fix a smashed skull with exposed brain tissue. The physician is expected to recognize that this injury is fatal and to not attempt treatment. Now compare that to case 1, which is a wound in the head that penetrates to the bone but doesn't fracture the skull. The examination describes what to look for. The diagnosis is a wound in his head not penetrating to the bone of his skull. And the verdict is an ailment which I will treat. The treatment instructions then follow. Thou shouldst bind fresh meat upon it the first day. If thou findest that wound open, thou shouldst draw together for him his gash with stitching. Thou shouldst bind it with fresh meat the first day and treat it afterward with grease and honey every day until he recovers. Fresh meat as a bandaging material for the first day, that would help stop the bleeding and start the clotting process. Then stitches to close the wound if it's gaping. Then the reliable grease and honey treatment for the following days to prevent infection and promote healing. This is practical, effective wound care. No magic spells. No crushed lizard powder. Just observation, diagnosis, and evidence-based treatment. The Edwin Smith Papyrus contains 48 of these cases, and they're all written in this clear, clinical style. It's a teaching text. It's meant to instruct student doctors in how to examine patients, how to recognize different types of injuries, how to determine whether treatment is possible, and how to perform that treatment if it is. If you were training to be a surgeon in ancient Egypt, you would have studied this text extensively. You would have memorized these cases. You would have copied the papyrus yourself by hand to really internalize the information. And here's something else interesting. The Edwin Smith Papyrus contains glosses. These are additional notes written by a later scribe who's copying or studying the text, explaining certain words or concepts that might be unclear. For example, there are glosses that define anatomical terms or that explain what certain symptoms indicate. This suggests that the papyrus was actively used as an educational tool, with teachers or advanced students adding explanatory notes for the benefit of those who came after them. It's like someone annotating a textbook. The glosses also suggest that medical knowledge accumulated over time. The original text is clearly quite old, possibly from the Old Kingdom. Then it's copied during the Middle Kingdom, and someone adds glosses to explain things. Then it's copied again during the New Kingdom, when Edwin Smith's version was created, possibly with additional notes. So you have this continuity of medical knowledge being preserved, studied, added to, and passed down through generations of physicians. Now, contrast the Edwin Smith Papyrus with the Ebers Papyrus, which is much more typical of Egyptian medical texts overall. The Ebers Papyrus is massive. It's one of the longest medical papyri we have, over 20 meters long when unrolled. It contains those 800-plus prescriptions I mentioned earlier, covering a huge range of ailments from asthma to depression to skin conditions to digestive problems. And unlike the Edwin Smith Papyrus, the Ebers Papyrus is absolutely full of magic. There are spells and incantations throughout. There are prescriptions that include bizarre ingredients like human excrement, the milk of a woman who has borne a male child, the blood of various animals, crushed gemstones. The treatments are organized by symptom rather than by anatomical location, so it jumps around from head ailments to foot ailments to internal problems with no particular systematic organization. If you were a student doctor studying the Ebers Papyrus, you'd be learning a very different kind of medicine than what the Edwin Smith Papyrus teaches. You'd be learning a huge catalog of prescriptions to memorize. You'd be learning which magical spells to recite for different conditions. You'd be learning about the properties of hundreds of different ingredients, both sensible ones like medicinal herbs and absolutely bonkers ones like powdered crocodile dung. And yet, both of these texts were considered valuable medical knowledge. Both were studied by physicians. Both were copied and preserved, Because Egyptian medicine, as I keep saying, was this combination of empirical observation and magical thinking, and the Egyptians didn't see these as contradictory. You could absolutely believe that honey helped wounds heal, because you'd seen it work repeatedly, and also believe that reciting a spell over the honey would make it work even better by invoking divine assistance. Both approaches were valid. Both were part of being a complete physician. Specialized tools, strange ingredients, and the business of being a doctor. So you're a student doctor in ancient Egypt, and you're juggling these two very different approaches to medicine. On one hand, you're learning surgical techniques from the Edwin Smith papyrus, learning to examine wounds systematically, learning when to treat and when to admit defeat. On the other hand, you're memorizing endless lists of prescriptions from the Ebers papyrus, many of which include ingredients that make absolutely no sense from a modern perspective, but which your teachers swear by because they've been used for centuries. And you're also learning to use medical instruments because Egyptian physicians had an impressive array of tools. We found bronze and copper surgical implements in tombs and archaeological sites. Knives of various sizes, from large cutting blades to small precise scalpels. Forceps for gripping and holding tissue. Hooks for retracting skin or extracting foreign objects. Probes for examining wounds and abscesses. Surgical scissors, though these were probably less common than knives. Saws, which could be used for amputation or for cutting through bone, though amputation seems to have been relatively rare in ancient Egypt compared to later periods. They also had cauterization tools. These were metal instruments that would be heated in fire and then applied to wounds to stop bleeding or to burn away diseased tissue. Cauterization was a standard medical technique throughout the ancient world, and Egyptian doctors definitely used it. There are references in the medical texts to treatment with fire, which almost certainly means cauterization. For examining patients, they had instruments for looking into the eyes, ears, and throat. They had probes for examining body cavities. They understood the importance of good lighting during examination, so procedures would be done in bright daylight when possible, or with multiple oil lamps if they had to work at night or indoors. Student doctors would learn to use all of these tools under supervision. You'd start with the simpler techniques, using a probe to examine a wound, using forceps to remove a splinter, and gradually work up to more complex procedures like suturing or cauterization or lancing an abscess. You'd practice on training materials first, probably animal tissues or leather, getting the feel for how much pressure to apply, how to control the instrument, how to work quickly but carefully. And you'd learn to maintain your instruments. Bronze and copper tools needed to be kept sharp, kept clean, stored properly. A rusty or corroded instrument wasn't just ineffective. It could actually harm the patient. So part of medical training was learning the practical care of your equipment. This was your toolkit, your livelihood. You took care of it. Beyond surgical tools, physicians also needed equipment for preparing medicines. Mortars and pestles for grinding ingredients into powder. Various containers and jars for storing prepared remedies. Measuring implements, probably small cups or scoops of standardized sizes, for ensuring the correct proportions in prescriptions. Strainers for filtering liquid medicines. Heating vessels for preparing decoctions and infusions. The actual preparation of medicines was a significant part of a physician's work. You didn't have a pharmacy where you could just pick up pre-made prescriptions. If a patient needed a specific remedy, you made it yourself, or you had an assistant make it under your supervision. This required skill. Some ingredients needed to be roasted, others ground fresh, others soaked or boiled. Getting the preparation wrong could make the medicine ineffective or potentially dangerous. And this brings us to another aspect of medical training that's easy to overlook. Student doctors had to learn to source ingredients. Where do you get good quality frankincense? Where can you find the specific type of acacia that you need for certain prescriptions? What's the best season to harvest particular plants? How do you store dried herbs so they maintain their potency? Can you trust the merchants in the market? Or do you need to collect ingredients yourself to ensure quality? Egypt had access to a wide range of medicinal plants, both native and imported through trade. From the Egyptian landscape itself, you had plants like acacia, sycamore, dates, figs, coriander, cumin, flax, and papyrus, all of which had medicinal uses. From trade with Nubia and Punt to the south, you could get frankincense, myrrh, ebony, and various exotic resins. From trade with the Near East and Mediterranean, you could get cedar oil, terebinth resin, and other materials. Some ingredients were common and cheap. Others were rare and expensive. A prescription calling for frankincense and myrrh was a luxury treatment, affordable only for wealthy patients. A prescription using local herbs and honey was something anyone could obtain. Student doctors would learn to adapt prescriptions based on what was available and what their patients could afford. There might be multiple versions of a remedy, an expensive version with imported ingredients and a cheaper version using local substitutes. They'd also learn about ingredient substitutions. If a prescription calls for a particular plant that's out of season, what can you use instead that has similar properties? This kind of practical knowledge wasn't always written down in the formal medical texts. It was the kind of thing you learned from your mentor through experience. Oh, we're out of that? Use this instead. It's not quite as good, but it'll work in a pinch. Now, let's talk about what it was actually like to be a practicing physician in ancient Egypt once you'd completed your training. How did you make a living? Where did you work? What was a typical day like? The answer varied significantly depending on your status and location. If you were a royal physician, you were a salaried member of the pharaoh's household. You lived at the palace or close to it. Your job was to be available whenever the pharaoh or the royal family needed medical attention. You probably also treated important nobles and officials. In exchange, you received regular payment in the form of grain, beer, linen, and possibly land grants. You were comfortable, possibly wealthy, definitely secure. If you were a temple physician, you were part of the temple's staff. You might treat priests and temple workers primarily, but also members of the local community who came to the temple seeking healing. Temples were centers of community life, and they often had medical facilities. You'd receive your payment from the temple's resources, which came from offerings, land ownership, and the temple's various economic activities. If you were an independent physician, you'd set up your own practice, probably in your home or in a dedicated space if you could afford it. Patients would come to you, or you'd go to them if they were too ill to travel. Payment would be negotiated individually, probably on a case-by-case basis. Wealthy patients would pay more, poor patients would pay what they could, and sometimes you'd probably treat people for free if they had nothing to offer. We don't have detailed records of how much physicians charged or how they structured their fees, but based on evidence from other ancient cultures and from later periods of Egyptian history, there was probably some standard fee structure for common procedures. Setting a broken bone would cost this much. Extracting a tooth would cost that much. A house call would cost extra. Complex or risky procedures would command higher fees. There's some evidence that physicians might accept payment in kind rather than in money, especially in a society where most people didn't use coinage for everyday transactions. So you might be paid in grain or oil or bread or beer or cloth. A farmer might pay you with produce from his fields. A craftsman might pay you with items he's made. The barter economy was alive and well in ancient Egypt for most of its history. And just like today, there were probably good doctors and bad doctors. Skilled physicians who genuinely helped their patients and built strong reputations. Mediocre physicians who did an adequate job but nothing special. Incompetent physicians who hurt more people than they helped, or outright frauds who claimed medical knowledge they didn't actually possess. The medical texts sometimes warn about this. There are passages that essentially say, here's the correct treatment, and here's what ignorant people do instead. The implication being that there were people practicing medicine who didn't really know what they were doing. Maybe they'd learned a few remedies from their grandmother and set themselves up as healers. Maybe they were charlatans deliberately exploiting sick people. Either way, the professional physicians who'd actually trained properly seemed to be aware that they had competition from less qualified practitioners. Did patients know the difference? Sometimes, probably. If you'd been treated successfully by a physician before, you'd go back to that person. If you'd heard good things about a particular doctor from your neighbors, you'd seek them out. Reputation mattered. A physician who consistently got good results would attract more patients. A physician who lost patients or didn't seem to help would struggle to maintain a practice. But also, in a world where so many diseases were poorly understood and often fatal regardless of treatment, it was probably hard to distinguish between a good doctor who tried their best but couldn't save someone and a bad doctor who didn't know what they were doing. If someone died of an infection despite treatment, Was that because the doctor was incompetent, or because the infection was simply beyond ancient medicine's ability to cure? Hard to say. This is partly why the magical and religious components of Egyptian medicine were so important. Even when physical treatments failed, the physician could fall back on "the gods have not willed this person to recover" as an explanation. It wasn't your fault as a doctor. It was the gods' decision. This provided a kind of psychological protection for both the physician and the patient's family. Someone to blame other than the doctor. Let's talk about what happened in an actual medical consultation. A patient comes to you complaining of symptoms. Let's say they have a persistent cough that's been going on for weeks. What do? First, you'd conduct that systematic examination we talked about earlier. You'd look at the patient's general appearance. Are they thin and wasted, suggesting a serious underlying illness? Or are they well-nourished and otherwise healthy-looking? You'd check their temperature by feeling their forehead and body. Hot skin means fever. You'd look at their eyes. Are they clear or cloudy? Jaundiced? You'd look in their mouth and throat. Redness and inflammation. You'd listen to their breathing. Wheezing? Rattling sounds? You'd ask about the cough. When did it start? Does it happen more at certain times of day? Are they coughing up phlegm? What color is it? Is there blood in it? All of this information would help you form a diagnosis. Maybe you'd decide this is a simple respiratory infection that will clear up on its own with rest and supportive care. Maybe you'd think it's something more serious, like what we'd now call tuberculosis or pneumonia. Your diagnosis would be framed in Egyptian medical terms. Perhaps you'd say there's a blockage in the respiratory metu, or an imbalance of fluids in the chest, or that the patient's breathing channels have been invaded by disease-causing entities. Then you'd prescribe treatment. For a cough, Egyptian physicians had numerous remedies to choose from. A common one was a mixture of honey and milk, which actually does soothe the throat and suppress coughing. They might add ingredients like dates, frankincense, or juniper berries. They might prescribe an inhalation treatment, breathing in steam infused with various herbs and resins to help clear the lungs and airways. If the cough was severe or bloody, you might add magical protection to the treatment. You'd recite a spell over the medicine to invoke divine healing power. You might give the patient an amulet to wear, inscribed with protective spells. You might recommend that the patient make offerings at a temple to ask for divine assistance. Then you'd give instructions. Take this medicine 3 times a day. Rest as much as possible. Avoid cold air and cold drinks. Come back in a week so I can check your progress. If the symptoms get worse, come back immediately. And then you'd wait to see if the treatment worked. If the patient improved, great. Your reputation is enhanced. If the patient didn't improve, you might try a different remedy. If the patient died, well, it was a serious illness, you did your best, the gods have called them home. This is just how medicine worked in the ancient world. You tried, you learned from experience what tended to work, and you accepted that many conditions were ultimately beyond your power to cure. Now, one interesting aspect of Egyptian medical practice that we haven't really touched on yet is the role of diagnosis beyond just identifying symptoms. Egyptian physicians were apparently interested in identifying what we might call risk factors or predisposing conditions. The medical texts sometimes describe patient characteristics that make them more or less likely to recover from certain ailments. For example, there are passages that suggest physicians considered a patient's age, their overall constitution, their lifestyle, and their previous medical history when making a prognosis. A young, otherwise healthy person with a broken bone? Good chance of recovery. An elderly person who's already weak and sickly with the same broken bone? Much more uncertain outcome. This is sophisticated medical thinking. It's recognizing that the same injury or disease can have very different outcomes in different people depending on their individual circumstances. There's also evidence that Egyptian physicians recognized some diseases as being contagious or transmissible, though they didn't understand the mechanism of infection. They knew that certain skin conditions could spread from person to person. They knew that epidemics could sweep through communities. They took precautions, isolating sick people, avoiding contact with certain bodily fluids, purification rituals after treating contagious patients. Were these precautions effective? Sometimes, probably. Isolation would help prevent the spread of infectious diseases, even if the Egyptians didn't understand bacteria and viruses. Washing after treating patients, which was part of the purification ritual, would also help prevent transmission. So once again, we see this pattern where the Egyptians developed practices that worked even though their theoretical understanding of why they worked was completely wrong. Public health, parasites, and the prices of progress. Let's zoom out for a moment from individual medical practice and talk about health on a broader scale in ancient Egypt, because the environment you were living in had a huge impact on what kinds of medical problems you'd encounter as a physician. And ancient Egypt had some very specific health challenges that shaped the entire medical profession. First and foremost, the Nile. The river was the lifeblood of Egyptian civilization, obviously. It provided water, transportation, fertile soil from annual flooding, fish, waterfowl, everything. Without the Nile, there is no Egypt. But the Nile was also absolutely teeming with parasites and disease-causing organisms that made life pretty miserable for the average Egyptian. Schistosomiasis was probably the most widespread parasitic infection. This is caused by flatworms that live in freshwater snails. The larvae get released into the water, and when people wade into the Nile to fish, to wash, to collect water, to irrigate fields, the larvae burrow through their skin and mature into adult worms living in their blood vessels. These worms cause chronic inflammation, blood in the urine, abdominal pain, and over time, serious organ damage. We found schistosomiasis in Egyptian mummies. It was endemic. Probably the majority of Egyptians who lived near the Nile had it at some point. And there was basically nothing ancient medicine could do about it. The Egyptians knew that blood in the urine was a problem, and they had remedies for it, but they couldn't actually cure the underlying parasitic infection. So this was just a background condition that people lived with, along with reduced energy, chronic discomfort, and shortened lifespans. Then you had other intestinal parasites: tapeworms, roundworms, hookworms. We found these in mummy intestines too. People were getting infected from contaminated water, from eating undercooked fish or meat, from general poor sanitation. The symptoms would be digestive problems, malnutrition, anemia, abdominal pain. Egyptian physicians had various deworming remedies: pomegranate bark, male fern, colocynth, and some of these were probably somewhat effective at expelling intestinal worms. But you'd just get reinfected shortly afterward from the same environmental sources. Malaria was likely present too, transmitted by mosquitoes breeding in the marshes and irrigation canals. The Egyptians described fevers that came and went in regular patterns, which sounds a lot like malarial fevers. They had remedies for fever. Willow bark, which contains salicylic acid, the active ingredient in aspirin, was used. So they could treat the symptoms somewhat, but again, they couldn't actually cure malaria. Eye diseases were incredibly common, as I mentioned earlier when we talked about eye specialists. Trachoma, caused by bacterial infection, was endemic and led to blindness in many people if left untreated. The Egyptians had eye salves and treatments using copper compounds, which have antimicrobial properties, so these probably helped. But prevention would have been better, and that would have required understanding that the disease was transmitted by flies and through contact with infected people's eye secretions, which the Egyptians didn't quite grasp. So you've got this population that's chronically infected with various parasites and diseases, living in an environment that's actively making them sick on a regular basis. And as a physician, you're treating the symptoms and complications of all of this, but you're not addressing the root causes, because the root causes are built into the very environment that makes Egyptian civilization possible. Now, the Egyptians did have some public health practices that helped somewhat. They were relatively clean people by ancient standards. Wealthy Egyptians bathed regularly, used scented oils on their skin, shaved their body hair to avoid lice, wore clean linen clothing. Priests in particular had to maintain high standards of cleanliness. They bathed multiple times a day, shaved their entire bodies every few days, wore fresh white linen. This was partly religious ritual, but it had health benefits too. They also had latrines and waste disposal systems, at least in urban areas and in places like workers' villages. The archaeological site of Deir el-Medina, a village for the workers who built the royal tombs, has evidence of stone latrines built over pits that were regularly emptied. So they understood that human waste needed to be contained and removed. This would have helped reduce the spread of some diseases, though probably not as much as they needed given the other environmental factors. Embalming and mummification practices, while primarily religious, also served a public health function. Dead bodies were removed from the community quickly and processed in designated areas by specialists. This prevented corpses from becoming sources of contamination or disease. The embalmers themselves were at higher risk of infection from handling dead bodies, but they followed purification rituals and probably had some practical protective measures that helped reduce transmission. But for all of these practices, ancient Egypt didn't have anything we'd recognize as organized public health infrastructure. There were no sanitation departments, no water quality testing, no quarantine procedures for epidemics beyond ad hoc measures. Health was primarily an individual or family concern, not a collective social responsibility administered by the state, which meant that as a physician, you were treating the same problems over and over. Parasitic infections, eye diseases, digestive problems, fevers, skin conditions, dental problems from grain full of grit, injuries from agricultural work or construction. And while you could provide symptomatic relief and supportive care, you couldn't actually prevent most of these problems from recurring. This must have been frustrating on some level. The medical texts occasionally reflect what seems like resignation about certain conditions. This is a disease I cannot treat. This is a chronic ailment that will return. There's an acknowledgement that some things are just the reality of life in ancient Egypt, and the best a physician can do is make the patient more comfortable and perhaps extend their life somewhat. Now, let's talk about something we haven't really addressed yet: mental health and how Egyptian physicians understood and treated it. Did the ancient Egyptians have a concept of mental illness? The answer is complicated. They definitely recognized that people could experience emotional distress, strange behaviors, and altered mental states. The medical texts mention conditions like depression, though they didn't use that term. They describe people who are sad, who have lost interest in life, who can't sleep, who weep constantly. They recognized this as a medical problem that needed treatment. How did they understand it? Probably as a mixture of physical imbalance, something wrong with the heart, which remember was thought to be the seat of emotion, and supernatural influence. A person might be depressed because their heart is troubled, or because they're under the influence of a malevolent spirit, or because they've offended a god. Treatment would address both possibilities. Physical treatments for what we'd call depression or anxiety might include calming herbs. The Egyptians used opium, which is definitely a mood-altering substance. They used alcohol medicinally. They used various sedative plants. They also recommended activities: bathing, massage, pleasant music, good food, time spent in gardens. These are basically cognitive and behavioral interventions, trying to improve the person's mood through pleasant experiences and relaxation. Magical and religious treatments would include protective amulets, spells to drive away harmful spirits, offerings to gods, consultation with oracles or dream interpreters. If someone believed their depression was caused by a curse or by divine displeasure, then addressing those supernatural causes would be an important part of treatment. For more severe mental disturbances, what we might call psychosis, mania, or severe dissociative states, the Egyptians seem to have attributed these primarily to supernatural causes. Demon possession, divine punishment, that sort of thing. Treatment would be heavily focused on magical and priestly interventions. Exorcism rituals, elaborate spells, pilgrimages to healing shrines, extended stays at temples where priests would perform ongoing rituals to drive out the possessing entity. Did any of this work? From a modern medical perspective, no, you can't exorcise a mental illness. But from a psychological perspective, if the patient believed they were possessed and believed that the ritual had successfully removed the demon, they might feel significantly better afterward. The placebo effect is powerful, especially for conditions with a strong psychological component. And the ritual itself provided structure, attention, community support, and the sense that something was being done, all of which can be therapeutically beneficial. Egyptian physicians who specialized in treating mental and emotional ailments were probably among those priest-physicians or Sao practitioners we talked about earlier. This wasn't really the domain of the surgical specialists. This was where you needed religious authority, ritual expertise, and the ability to mediate between the human and divine realms. All right, let's circle back to the education and training process. because there's one aspect we haven't fully explored. How did medical knowledge actually get preserved and transmitted across generations? We've talked about the papyri and the apprenticeship system, but there's more to it than that. Medical knowledge in ancient Egypt was preserved in several ways. Obviously, there were the written texts, the papyri we keep discussing, but writing materials were expensive, and creating a copy of a medical text was a significant investment of time and resources. So not every physician would have had their own personal library of medical texts. These would have been institutional resources, kept in temple libraries and houses of life, or treasured possessions of wealthy physicians who could afford to commission copies. But a lot of medical knowledge was transmitted orally through the apprenticeship system. A student would watch their teacher work, and the teacher would explain what they were doing and why. This type of wound requires these stitches at this spacing because if you space them too far apart, the wound won't close properly. But if you space them too close together, you'll damage the tissue unnecessarily. That kind of practical, hands-on knowledge doesn't necessarily get written down in formal texts, but it gets passed along through demonstration and practice. And then there's experiential knowledge that each physician accumulated over their own career. You try a treatment and you observe whether it works. You modify the prescription slightly, more of this ingredient, less of that one, and see if it works better. Over time, you develop your own personal understanding of what works best for different conditions. Some of this might get written down in personal notes or annotated texts, but a lot of it probably stayed in the physician's memory. This creates an interesting dynamic where medical knowledge was simultaneously conservative and innovative. Conservative because the fundamental texts and techniques were being passed down largely unchanged for centuries. Innovative because individual physicians were constantly adapting, experimenting, and learning from experience within that traditional framework. We can actually see this in the papyri themselves sometimes. There are prescriptions that include variations, another remedy for the same condition, followed by a different list of ingredients. This suggests that physicians knew multiple approaches to the same problem and could choose which one to try based on availability of ingredients, patient characteristics, or their own experience with what worked better. Famous physicians, failed treatments, and the flow of knowledge. So you've got this accumulation of medical knowledge happening over centuries, with each generation of physicians adding their own observations and modifications to the inherited tradition. And occasionally, some physicians became famous enough that their names survived in the historical record, which is pretty remarkable when you think about how many millions of people lived and died in ancient Egypt without leaving any trace of their individual existence. We already mentioned Imhotep, who's probably the most famous Egyptian physician, though he was also an architect, a priest, a government official, basically a Renaissance man a couple thousand years before the Renaissance. He lived during the 3rd dynasty around 2650 BCE and served Pharaoh Djoser. He's credited with designing Djoser's step pyramid at Saqqara, which is one of the earliest monumental stone structures in Egypt. But he was also renowned as a physician and a wise man. And here's where it gets interesting. Imhotep's reputation grew over time. During his lifetime, he was an important official. After his death, he became legendary. By the late period of Egyptian history, over 2,000 years after he lived, Imhotep had been deified. He became a god of medicine and healing. People made pilgrimages to his cult centers. They left offerings asking for healing. Sick people would sleep in his temples hoping to receive healing dreams in which Imhotep would appear and tell them how to cure their ailments. The Greeks later identified Imhotep with their own god of medicine, Asclepius. So Imhotep's influence extended beyond Egypt into the Greek medical tradition. That's a pretty impressive legacy for a physician, though it's worth noting that we don't actually have any writings directly attributable to Imhotep. We don't know what specific medical techniques he developed or what his actual contributions to medicine were. His fame is more about his overall reputation as a wise healer than about any specific medical innovation we can point to. But the deification of Imhotep tells us something important about how ancient Egyptians viewed medicine. It was sacred knowledge. The best physicians weren't just technically skilled. They were touched by divine wisdom. They were intermediaries between human suffering and divine healing power. Imhotep becoming a god makes perfect sense in that context. He was so wise, so skilled, that he transcended normal human limitations and became something more. Another notable physician was Hezra, who lived around the same period as Imhotep. His tomb at Saqqara identifies him as Chief of Dentists and Physicians. That double title is interesting. It suggests he was head of both the dental and medical professions, or at least had expertise in both areas. His tomb reliefs show him with the tools and symbols of a scribe and official, emphasizing his literate, educated status. These high-level physicians were members of the elite class, remember. They weren't humble village healers. They were educated professionals who moved in the same circles as nobles and high priests. Then there's Peshet, the lady overseer of female physicians we mentioned earlier. She lived during the 4th dynasty around 2500 BCE. We know frustratingly little about her beyond her title, but that title is significant. Overseer means she was in an administrative position, supervising other physicians. This wasn't just one woman who happened to become a doctor. This was a woman in charge of a whole group of female physicians, which suggests that women's medicine was an organized specialty with its own hierarchy. Unfortunately, because medical knowledge was so often passed down through male family lines, and because most of the written record focuses on men, we don't have much information about female physicians' training or practices. Did they learn the same material as male physicians? Were there separate texts or traditions specifically for women's medicine? Did they only treat female patients, or could they treat anyone? We can make educated guesses, but we don't know for certain. What we do know is that midwifery was primarily women's work, and midwives would have had extensive practical knowledge about pregnancy, childbirth, and postpartum care even if they weren't formally trained as physicians. There was probably some overlap and collaboration between female physicians and midwives, with physicians handling more complicated cases or providing medical backup when things went wrong during childbirth. Now, let's talk about medical failures because they're just as instructive as medical successes when you're trying to understand Egyptian medicine. What couldn't Egyptian physicians treat effectively? What were the limits of their knowledge and skill? Surgery, while impressively advanced for the time, was still limited by the inability to safely open the major body cavities. Egyptian physicians could work on surface injuries, could drain abscesses, could remove superficial tumors, could set bones. But they couldn't perform abdominal surgery or thoracic surgery. Opening the chest or abdomen without modern surgical techniques, anesthesia, and infection control is basically a death sentence. The patient would die from shock, blood loss, or infection. The Edwin Smith papyrus is very clear about this. When it gets to cases involving penetrating wounds of the chest or abdomen, the verdict is almost always an ailment not to be treated. A spear wound that goes through the chest wall and into the lungs? Not treatable. A stab wound to the abdomen that perforates the intestines? Not treatable. The physician can bind up the external wound and try to make the patient comfortable, but recovery is basically impossible. This limited what conditions could be addressed surgically. Internal tumors, unless they were close to the surface and accessible, couldn't be removed. Hernias might be reducible, pushed back into place, but couldn't be surgically repaired with lasting results. Kidney stones, gallstones, bladder stones caused excruciating pain, and while there were remedies to try to dissolve them or ease the passage of small stones, large stones were basically untreatable. Infections were another major limitation. Egyptian physicians had some tools for fighting infection: honey, moldy bread, copper compounds, various antimicrobial plants. But for serious systemic infections, sepsis, overwhelming bacterial diseases, there wasn't much they could do. If an infection went deep into bone, causing osteomyelitis, the patient might survive but would be left with chronic problems. If an infection spread through the bloodstream, the patient would likely die despite treatment. Childbirth complications were often fatal for both mother and baby. Obstructed labor, where the baby couldn't pass through the birth canal, usually resulted in the death of the baby and often the mother too. Without the ability to perform cesarean sections safely, and there's no good evidence the Egyptians did this, there was no way to extract a baby that couldn't be born naturally. Postpartum hemorrhage, placental problems, eclampsia, these were all potential death sentences. Cancer was recognized as a disease. There are descriptions in the medical papyri of tumors and growths, but there was no effective treatment beyond surgical removal of superficial tumors. Internal cancers, metastatic disease, blood cancers like leukemia were completely beyond ancient medicine's ability to treat. The patient would waste away and die, and all the physician could do was provide palliative care. Diabetes, heart disease, stroke, epilepsy, chronic degenerative conditions, these were all recognized as medical problems, but the treatments were largely ineffective. You could treat symptoms, provide supportive care, pray to the gods, but you couldn't cure the underlying disease. Many people probably died in what we'd consider middle age from conditions that are now manageable or even preventable. And then there were the treatments that actually made things worse. Not all Egyptian medicine was benign. Some of the remedies were actively harmful. Putting excrement on wounds, which several prescriptions call for, would introduce bacteria and likely cause infection rather than preventing it. Some of the mineral and metal compounds used in medicines were toxic. Lead compounds, antimony, mercury, these show up in Egyptian pharmacology, and they would have caused poisoning with prolonged use. Some surgical procedures, like trepanation, probably killed more patients than they helped, even if some people did survive. Drilling holes in skulls without understanding intracranial pressure, without sterile techniques, without antibiotics. This was incredibly risky. It might occasionally provide relief if the patient had a subdural hematoma or severe intracranial pressure, but more often it probably just introduced infection into the brain. Cauterization was painful and traumatic and left terrible scars, even if it did stop bleeding. The lack of effective anesthesia meant that any painful procedure was an ordeal. Even with opium or alcohol, you're still conscious and aware of what's happening while someone cuts into your flesh or burns your tissue. The psychological trauma of ancient medical procedures must have been significant. So Egyptian physicians were working within pretty severe limitations. They could fix some things. They could make some patients more comfortable. They could provide care and attention that probably had real psychological benefits even when the physical treatments didn't do much. But they couldn't cure many of the diseases that plagued their population, and some of their treatments were ineffective or actively harmful. And yet they kept trying. They kept observing. They kept recording their observations in medical texts. They kept training new generations of physicians. Knowledge accumulated slowly over centuries. The medical tradition adapted and evolved, incorporating new observations and discoveries. One way this happened was through contact with other cultures. Egypt didn't exist in isolation. Traded with Nubia, Punt, the Near East, the Mediterranean world. Egyptian physicians would have encountered medical practices from these other cultures and might have adopted useful techniques or ingredients. Foreign physicians might have come to Egypt, bringing their own knowledge with them. During the New Kingdom, when Egypt's empire was at its height, there would have been extensive cultural exchange. Egyptian physicians treating foreign patients might have learned about remedies used in those patients' home countries. Egyptian soldiers campaigning in Syria or Nubia might have been treated by local healers and brought back information about their techniques. Trade in medicinal substances would have introduced Egyptian physicians to new ingredients and new applications. We know that later, during the Greek and Roman periods, there was significant cross-pollination between Egyptian and Greek medicine. Greek physicians studied Egyptian medical texts and incorporated Egyptian remedies into their own practice. Egyptian physicians adopted some Greek medical theories and techniques. This synthesis created new medical traditions that blended elements from both cultures. But even during the pharaonic period, there was probably some amount of this cultural exchange happening. The medical texts occasionally mention foreign ingredients or foreign names for diseases, suggesting awareness of medical practices from other regions. The Egyptians were pragmatic. If something worked, they'd use it regardless of where it came from. This brings us to an interesting question. How much did Egyptian medicine influence later medical traditions? We know that the Greeks admired Egyptian medicine. Herodotus praised Egyptian physicians. Greek medical writers mentioned Egyptian remedies and techniques. The famous medical school at Alexandria, which flourished during the Hellenistic period after Alexander the Great conquered Egypt, was built on a foundation that included both Greek and Egyptian medical knowledge. Some Egyptian medical concepts probably survived into later medical traditions, though they got transformed along the way. The idea of channels in the body that needed to stay clear and flowing, that's not too different from Greek humoral theory or even from traditional Chinese medicine's concept of qi flowing through meridians. Did these ideas develop independently? Or was there some ancient cultural exchange that spread these concepts? Hard to say definitively, but the similarities are intriguing. Specific remedies also persisted. Castor oil as a laxative used in ancient Egypt was still being used in the 20th century. Honey as a wound treatment, rediscovered by modern medicine as an effective antimicrobial, was standard practice in ancient Egypt. Willow bark for pain and fever, which led eventually to the development of aspirin, was used by Egyptian physicians. So there's continuity. Some of what the ancient Egyptians figured out through trial and error and empirical observation turned out to be genuinely effective and survived into modern medicine, even if we now understand the mechanisms differently than they did. But there's also discontinuity. Much of Egyptian medical theory was wrong and was eventually replaced by better understanding of anatomy, physiology, and disease. The magical and religious components of Egyptian medicine were largely abandoned by later, more secular medical traditions, at least in their explicit forms. The specific, elaborate prescriptions with dozens of weird ingredients were mostly forgotten. Daily life of a physician, death and dying, and the long view of medical legacy. Let's get even more specific about what daily life looked like for an Egyptian physician, because we've talked a lot about training and theory, but what did you actually do day to day? You wake up in your house, which if you're a successful physician is probably reasonably comfortable. A few rooms, some furniture, maybe a small garden, definitely better than what the average farmer lives in. You're educated, literate, respected in your community. Not quite elite nobility, but solidly professional class. Your first task of the day might be preparing medicines. You've got patients coming later who will need remedies, and these need to be fresh or properly prepared. So you're in your workroom, grinding ingredients in your mortar and pestle. The repetitive motion is almost meditative at this point. You've done this thousands of times. Crush the dried herbs, add a bit of honey, mix in some oil, work it into a paste. The smell is pungent, medicinal, familiar. Maybe you have an apprentice helping you, a young kid from another medical family who's been studying with you for a couple years now. You're teaching him as you work. See how the consistency changes when you add the oil slowly versus all at once? You want it smooth, not grainy. If it's grainy, it won't spread properly on the wound. The kid nods, concentrating, trying to memorize everything. You remember being in his position once, desperately trying to absorb everything your own teacher told you. Patient arrives. This is someone you've seen before, an older man with chronic joint pain. His hands are gnarled from decades of manual labor, probably farming or construction. You examine his hands, feeling the swollen joints, noting how he winces when you apply pressure. You prescribe the usual remedy, a mixture of anti-inflammatory herbs applied as a warm poultice. You know this won't cure him. The damage to his joints is permanent, but it'll reduce the inflammation and ease the pain for a while, which is the best you can do. You give him the poultice and explain how to apply it. Heat it gently. Don't make it too hot or you'll burn your skin. Wrap it around the affected joints. Leave it on for a few hours. Come back in a week if it's not helping. He thanks you, pays you with a basket of onions and some bread, and leaves. It's not much payment, but he's a poor man and you accept what he can offer. You've got wealthier patients who pay better. Next patient is a young woman with a sick child. The child has a fever and a cough, has been ill for several days. This is worrying because childhood diseases kill frequently. You examine the child carefully. Feverish, yes, but alert and responsive. The cough is wet, productive. The child is coughing up phlegm, which is actually a good sign because it means the lungs are clearing themselves. You've seen worse. You prepare a fever-reducing remedy, willow bark decoction with honey to make it palatable for a child. You also give the mother some honey-based cough syrup. Keep the child warm but not too hot. Make sure they drink plenty of fluids. If the fever gets much higher or if the child becomes unresponsive, come back immediately. The mother is worried, anxious, hovering over the child. You try to be reassuring without making promises you can't keep. Many children recover from illnesses like this. Many don't. You just have to wait and see. After a few more routine consultations, a man with a minor cut that needs cleaning and bandaging, a woman with digestive complaints who gets a purgative remedy because of course she does, you have a more serious case. A construction worker has fallen from scaffolding and broken his arm. The bone is fractured but not compound, which is good. You can work with this. You have the patient lie down and you manipulate the arm, feeling for the break, assessing how the bones are misaligned. This hurts and the patient is grimacing, trying not to cry out. Your apprentice is holding the patient's shoulder steady. You pull the arm gently but firmly, feeling the bones shift, and then they're aligned. You can feel it in your hands. The bones are in the right position now. You splint the arm using wooden slats and linen bandages, wrapping everything snugly but not so tight that it cuts off circulation. You check the patient's fingers. Can he still feel them? Can he move them slightly? Good. The splint is secure but not too constrictive. You explain that he needs to keep the arm immobilized for at least a month, probably longer. No work. No lifting anything heavy. Come back in a few days so you can check that the splint is still properly positioned and that there's no infection developing. This patient has family with him who can pay reasonably well, so you accept payment of grain and some fine linen cloth. The patient will survive and the arm should heal, though it might not be quite as strong as it was before. He might have chronic pain or stiffness, but he'll be able to use it, which is better than some outcomes. An improperly set bone can heal crooked, leaving the limb deformed and barely functional. The rest of your day continues like this. A mix of minor complaints, chronic conditions, occasional acute injuries or illnesses. Some patients you can help significantly. Some you can help a little. Some you can't really help at all, but you go through the motions because doing something feels better than doing nothing, both for the patient and for you. In the evening, after your last patient has left, you sit down to review your medical texts. You've got a partial copy of the Ebers papyrus that belonged to your teacher, passed down to you when he died. You're looking up a prescription for a condition you saw today, refreshing your memory on the exact proportions of ingredients. The papyrus is old, fragile, the writing faded in places. You handle it carefully. Your apprentice is copying out a section of the text, practicing his hieratic script and memorizing the prescriptions at the same time. This is how it continues. You learned from your teacher, you're teaching your apprentice, he'll eventually teach his own students. The knowledge flows down through generations, preserved in these precious texts and in the accumulated experience of practicing physicians. Before bed, you might say prayers to Thoth or Sekhmet or Isis, asking for divine guidance in your work, thanking the gods for the patients you were able to help, asking for wisdom to better serve those you'll see tomorrow. You're tired. It's been a long day. Medicine is demanding work, physically and emotionally, but it's also meaningful work. You're helping people. You're easing suffering. You're part of an ancient and honorable tradition. This day after day, year after year is what being an Egyptian physician looked like. Not glamorous, not consistently dramatic, but steady, meaningful work punctuated by moments of crisis and triumph and tragedy. Now, let's talk about death, because Egyptian physicians dealt with it constantly. Not just the abstract knowledge that death exists, but the actual lived experience of watching patients die despite your best efforts. How did Egyptian physicians cope with this? How did they think about death and their role in relation to it? First, it's important to understand that death was a much more present reality in ancient Egypt than it is for most people in modern developed countries. Child mortality was high. Maybe a third of children died before age 5. Women died in childbirth regularly. Infectious diseases swept through communities. Accidents and violence claimed lives. People died young by modern standards. Living to age 50 was doing pretty well. Living to 60 or beyond was genuinely elderly. So Egyptian physicians weren't seeing death as an unusual or shocking event. It was part of life. They expected to lose patients regularly. The medical texts reflect this expectation. There are numerous conditions classified as not to be treated because they're recognized as fatal. The physician isn't expected to work miracles. They're expected to do what's possible and acknowledge what isn't. But Egyptian culture also had this elaborate belief system around death and the afterlife that probably helped physicians cope with patient deaths. Death wasn't the end. It was a transition. If the person had lived well, if they'd followed Ma'at, truth, justice, order, if they'd made proper preparations for the afterlife, then death was just the doorway to eternal life in the field of reeds. a paradise where they'd be reunited with deceased loved ones and live in peace forever. So when a patient died, the physician could frame it as the gods calling that person home, as the person's journey continuing into the next realm. It wasn't failure exactly. It was the natural order of things. The physician had done their duty by trying to extend the person's life in this world, but ultimately, the timing and circumstances of death were in the hands of the gods. This religious framework provided psychological comfort not just for the physicians but for patients and their families too. You weren't dying pointlessly. You were moving on to the next phase of existence. Your death had meaning within the cosmic order. And as long as your body was properly preserved and you passed the judgment of your heart, you'd achieve immortality. The whole mummification industry was built on this belief, and physicians had close professional connections with embalmers. Some physicians probably performed embalming services themselves, or at least consulted on the process. The anatomical knowledge gained from embalming informed medical practice, as we've discussed. And both professions were concerned with the body, physicians with maintaining life, embalmers with preparing for the afterlife. So there was a kind of philosophical and professional continuity. You treated the living as long as you could, and when they died, other specialists took over to prepare them for eternity. Everyone had their role in this cycle: birth, life, death, afterlife. Midwives brought people into the world. Physicians kept them alive as long as possible. Embalmers prepared them for the next world. Priests performed the rituals to ensure safe passage. It was all interconnected. Did individual physicians still feel grief or frustration when patients died? Probably yes. Ancient Egyptians were human beings with emotions just like anyone else. Losing a patient you'd been treating for months or years, especially a patient you'd developed a relationship with, would hurt. Losing a child patient was probably particularly painful. But the cultural and religious framework provided a way to process that grief and continue functioning professionally. And remember, physicians also celebrated successes. When you set a broken bone and it healed properly, that was satisfying. When you treated a wound and the patient recovered without infection, that felt good. When you delivered a baby safely or cured a child's fever or relieved someone's chronic pain, those were victories worth celebrating. The work wasn't all death and failure. There were genuine triumphs too. Over a long career, a physician would accumulate a complex relationship with mortality. You'd see patterns. You'd learn to recognize when a patient was likely to recover and when they weren't. You'd develop a sense of medical realism, knowing what was treatable and what wasn't. And you'd probably develop some emotional calluses too, some professional distance that allowed you to function without being overwhelmed by the suffering you witnessed. But you'd also accumulate stories. That patient whose life you saved against the odds. That child who recovered when everyone thought they'd die. That grateful family who never forgot what you did for them. These stories would sustain you through the hard days when nothing you tried seemed to work. Medical ethics, competing healers, and the slow march of progress. Now let's talk about something we haven't really touched on yet: medical ethics. Did ancient Egyptian physicians have any kind of ethical code or professional standards? Were there rules about how you were supposed to treat patients, what you could or couldn't do, how you should conduct yourself as a physician? We don't have anything like the Hippocratic Oath from ancient Egypt, which is that famous Greek medical text where physicians swear to do no harm, maintain patient confidentiality, refuse to perform abortions or euthanasia, and generally behave ethically. The Egyptians might have had something similar that just didn't survive in the historical record, or they might have relied more on informal professional norms that everyone understood but didn't bother writing down explicitly. But we can infer some ethical principles from the medical texts and from what we know about Egyptian culture more broadly. First, there was definitely an expectation that physicians would try to help patients, not harm them. The whole point of medicine was healing. A physician who deliberately injured patients or who was grossly negligent would probably face social consequences, loss of reputation, possibly legal action, though again we don't have specific evidence of medical malpractice cases. Second, there seems to have been some concept of informed consent, or at least honest communication with patients. The medical texts instruct physicians to tell patients what their prognosis is. If an injury is fatal, you tell the patient that. You don't give false hope. You don't promise cures you can't deliver. This is actually a pretty sophisticated ethical stance. Patients deserve truthful information about their condition, even when that information is grim. Third, there was probably an expectation that physicians would treat anyone who came to them needing help, regardless of their ability to pay. Wealthier patients paid more, but poor patients weren't turned away. Medicine was a sacred profession, connected to the gods, and refusing to help someone in need would be a violation of Ma'at, that concept of justice and right order that was central to Egyptian morality. That said, we shouldn't romanticize this too much. Wealthy patients definitely got better care than poor patients. They could afford more expensive remedies with rare ingredients. They could afford longer consultations. They could afford the best physicians. Poor people probably relied more on folk healers and basic home remedies, only seeking out trained physicians for serious problems. Social inequality affected access to healthcare in ancient Egypt just like it does everywhere else throughout history. There was also probably an expectation of professional discretion. What you learned about a patient's condition while treating them wasn't gossip to spread around. This would be especially important for treating royal or noble families, where information about someone's health could have political implications. A physician who couldn't keep secrets wouldn't last long in those positions. And there must have been some expectation that physicians would maintain their skills and knowledge. You were supposed to study the medical texts, learn from more experienced doctors, keep practicing and refining your techniques. A physician who got lazy or complacent, who stopped learning and improving, would probably see their reputation suffer as patients got poor results and word spread. But beyond these general principles, we don't really know what specific ethical rules or norms Egyptian physicians followed. Did they have debates about controversial treatments? Were there medical procedures that some physicians considered acceptable and others considered unethical? What happened when different physicians disagreed about how to treat a patient? The historical record doesn't give us clear answers to these questions. What we do know is that Egyptian physicians weren't the only healers operating in ancient Egypt. They had competition from various other types of practitioners. Folk healers who used traditional remedies passed down through their families. Magicians who specialized in magical healing and protective spells. Priests who performed healing rituals in temples. Midwives who handled childbirth. Wise women and men in villages who had accumulated practical medical knowledge through experience. Some of these practitioners were probably competent and helpful. Others were probably charlatans taking advantage of desperate people. And from a trained physician's perspective, the existence of all these competing healers must have been frustrating. You've spent years studying medical texts, learning anatomy, practicing surgical techniques, and then someone with no formal training is treating patients with random folk remedies and calling themselves a healer. The medical texts occasionally reflect this tension. There are passages that essentially say, here's the correct treatment, and here's what ignorant people do instead, and don't be like those ignorant people. There's a sense of professional pride, a sense that trained physicians knew better than untrained healers, even if the public didn't always appreciate the difference. But the reality is that ancient medical knowledge was limited enough that sometimes folk remedies worked just as well as formal medicine. If your grandmother's herbal tea for coughs actually relieved the symptoms, why would you pay a physician for a more expensive remedy that did essentially the same thing? If the village wise woman could set your broken finger adequately, why seek out a specialist? So physicians had to compete on the basis of reputation and results. If you were known as a skilled physician who got good outcomes, people would seek you out and pay for your services. If you weren't particularly skilled, or if your treatments didn't work better than cheaper alternatives, you'd struggle to build a successful practice. This created some incentive for physicians to actually be good at what they did, to genuinely try to help patients and to accumulate knowledge about what worked. It also created incentive for showmanship, elaborate rituals, expensive ingredients, impressive-sounding incantations, anything that would convince patients that they were getting superior care that justified the higher cost. And let's be honest, some of the elaborate magical components of Egyptian medicine were probably partly about creating that impression of special expertise. If anyone could brew up honey and herbs, that's not very impressive. But if you've got this rare imported resin and the secret spell that was revealed by the god Thoth himself, and you're performing this complex ritual while preparing the medicine, well, now it seems like you're doing something special that ordinary people can't replicate. You're justifying your professional status and your fees. But does this mean Egyptian physicians were just con artists? No, not really. Most of them genuinely believed in what they were doing. They believed the magical components were important. They believed they were channeling divine wisdom. They weren't cynically manipulating patients. They were practicing medicine according to their culture's understanding of how healing worked. The physical treatments and the spiritual treatments were both real and necessary from their perspective. Now, let's talk about how medical knowledge advanced over the centuries. Because Egypt's history spans thousands of years, and medicine in the Old Kingdom probably wasn't identical to medicine in the New Kingdom or the Late Period. How did things change? How did medical knowledge grow and develop? Honestly, we don't see dramatic revolutionary changes in Egyptian medicine the way we do in some other cultures at certain historical moments. Egyptian medicine was remarkably conservative. The fundamental texts and approaches that were established early on continued to be used for millennia. The Edwin Smith papyrus, probably originally from around 2500 BCE, was still being copied and studied over 1,000 years later. That's extraordinary continuity. But there were gradual changes and accumulations. New remedies were added to the pharmacological repertoire, probably discovered through experimentation or adopted from foreign sources through trade and cultural contact. New techniques were developed and refined. Specialization increased over time. Those specialist physicians Herodotus mentioned were probably more common in later periods than they were in earlier ones. There's some evidence that during the New Kingdom, when Egypt had extensive contact with foreign cultures through trade and military campaigns, there was increased incorporation of foreign medical knowledge. Syrian and Mesopotamian medical concepts and remedies show up in some later medical texts. This cross-cultural exchange probably enriched Egyptian medicine, giving physicians access to new ideas and treatments. The Late Period and Ptolemaic period saw increasing Greek influence, which eventually led to the synthesis of Egyptian and Greek medicine at places like Alexandria. Greek physicians studied Egyptian texts and learned from Egyptian doctors. Egyptian physicians adopted some Greek medical theories, particularly ideas about the four humors and the importance of diet and exercise in maintaining health. But the pace of change was slow. If you were a physician in 1500 BCE and you somehow time traveled to 500 BCE, you'd still recognize most of what Egyptian physicians were doing. The tools would be similar. The texts would be familiar even if there were some new additions. The basic approach to diagnosis and treatment would be essentially unchanged. This is very different from, say, comparing medicine in 1900 CE to medicine in 2000 CE, where almost everything has been revolutionized. Why was Egyptian medicine so conservative? Partly because the culture itself was conservative, valuing tradition and continuity. The ancients had figured things out, and their wisdom should be preserved and honored, not carelessly discarded. Partly because the written texts were expensive and difficult to create, so once something was written down, it tended to stay in circulation for a very long time. And partly because without the scientific method, without controlled experiments, without systematic ways to test whether new approaches were actually better than old ones, it was hard to distinguish genuine improvements from just different ways of doing things. So medical knowledge advanced mostly through gradual accumulation of empirical observations. A physician notices that a particular plant seems to help with a particular symptom. They try it on multiple patients and confirm that it works. They teach it to their students. It gets incorporated into the body of medical knowledge. Eventually, someone writes it down in a medical text. Future generations of physicians learn it as part of their training. This is how things grew slowly, incrementally, over centuries. There were probably also individual physicians who were particularly innovative or skilled, who developed new techniques or made important observations, but whose individual contributions got absorbed into the collective tradition and weren't attributed to them specifically. Medical knowledge became communal property, the accumulated wisdom of the profession rather than the achievement of specific named individuals. This is actually pretty common in traditional knowledge systems. The knowledge matters more than who discovered it. What works is what gets preserved. Who first figured it out is less important than the fact that it's now known and can be used to help patients. So we have these rich medical texts full of sophisticated observations and effective treatments, but we don't know who made most of those discoveries. They're just part of the tradition.